trapezius is right around here. Actually, it's only about an inch from the occipital protuberance on either side, all right? There's, I even do it on myself. There, if you were to take, I believe it's bladder, it's, no, bladder 16? I think it's bladder 16. No, it can't be bladder 16. It has to be, I'm trying to think what this, I can't remember what point it is right here, right by the superior nuntial line. And thread it this way. That really relaxes the trapezius muscle. All right, I've done it on myself, and it really helps. Yeah, I've done it on me. It really works nice. Yeah, and I've done it. You know, you take a 1 chung needle and you go in like this. It's not that much. It really works nicely because you get a lot of. If you just right now, find your EOP and palpate lateral to it, and you'll feel all these little bumps, like almost, right? Those are different fibers of the trapezius that are in spasm. Okay, and very often when some people have like either a stiff neck or when they have headache problems, they'll have a lot of these little lumps. There's a technique in chiropractic that I use where I get it's brutal. You get the lump that bothers them the most up here, and then you go into the suprascapular. Or actually, you're going into the trapezius, the upper fibers of the trapezius. So you find the lump here, you find the lump, and you dig into it. And you ask them which one is more severe. And if they say the shoulder is more severe, well, then you try to find the most severe one up here, and you go and you palpate again, and you feel it. You palpate until you find that they're equal, because then those are the fibers that are in severe spasm. And by applying the pressure really deep in there, you'll actually almost see the fibers relax, and you'll see the muscles relax in that area. So that sometimes I do that when there's somebody that's really, really tense in the neck, and I just can't work it out with either the ultrasound therapy or the electrical therapy that I use or massage. So then I'll do something like that. But anyhow, there's that. I can't remember the name of the point. I'm sorry. But you go right in here, and you're getting all the fibers of the trapezius muscle, so it helps to relax it, all right? So if you extend your head back a little bit, all right, and then right away you could feel where the end of the trapezius is. Okay, put it down. These two lumps are really what muscle? Do we remember what muscle we were palpating with these two lumps? Semispinalis capitis, close, but no cigar. Okay, right there. But on top of it lies the trapezius muscle, all right? So once you find that, all right, we know the superior muscle up here is the semispinalis capitis. Go right underneath here is where your levator scapular is, okay, right in this area here. So have him shrug his shoulder, and you feel it right here. And once you feel it there, try to follow it down to the superior angle of the scapula. Just shrug again, and you'll feel that go right up there, okay? All right, shrug. Feel the difference, okay? Feel it up, relax again. Now, shrug. Come here. Touch right here, right under my hand. Feel it, okay? Go ahead, feel it. Feel it?
Shrug.
Shrug. It really, okay? And that's probably why this muscle gives a lot of us trouble. That's why small intestine 13 is always so tense. Do you ever notice yourself at the wheel? Really, like I used to get tremendous neck pain when I used to drive into the city, and I didn't understand why. Then one day, all of a sudden, I realized my shoulders were touching my ears. I call it shoulder and earlobe syndrome. It's like you're driving like this. Once you realize what you're doing, you can relax, okay? And then you realize the difference, okay? Usually what I explain to patients is rotate your shoulders up and back and let them drop. And that's where your shoulders should be, okay? And that'll help you to retrain and know where your shoulders should be, not up here like this. But that's why there's so many times you'll find that small intestine 13 trigger points or ashi points right there, okay? Okay, so that's levator. That's the upper part of the trapezius, all right? Then the middle part the middle part comes along this way here, Okay, retract your, okay, and you'll feel it going in here. Now, that's, you can see how it's retracted here, and you'll feel it all in there, okay? Now, relax. Now, depress the scapula, down, no. Bring this down like you're carrying a heavy bucket of water, all right? And then if you go in from the side here, you'll feel the remainder. You feel where it is? And that goes down to T12, okay? That's the trapezius. Keep doing it. Wait, let me find it, 1 second. Here. Feel the edge? Contracting, okay? And that goes down here, like that, okay? You feel it? You want to feel it? Keep going. Okay, feel it? You feel the edge? He's not doing it on this side, so I don't know if you feel, is he doing it on this side? Okay. Yeah, so right in here. Feel that right in there. You feel the edge? What? So the trapezius comes like this. Okay? So that's what you're dealing with. Okay, relax. All right.
Those muscles of the spine, though.
The erector spinae, those are underneath. These are all those are the deep muscles, okay? All right, so now we want to find the rhomboids underneath. So if he's to go like this, it'll bring the scapula out, right? So the rhomboids are attached right under here, and they're going in this direction. The major is here going up. The minor is right at the angle and going up, okay? So the minor is C7 to T1, and the major is T2 to like T5. Yeah. Okay, so try to retract now, and you can feel the whole underneath here. You can feel the, okay? So what you do is strum back and forth up. If you go up and down here, you can feel the angle. You can actually feel the angle as it goes up. Feel it? Okay. All right, good. All right, so then you'll feel that. All right, so we did, now the latissimus dorsi, put your arm on the side here. Latissimus dorsi, we know medially rotates. So we're going to do resistance against medial rotation. So medial rotation in this position would be his arm going like this. You see that? You see the way this is rotating this way with his arm going this way? If it's in this position, it's like this, medial rotation, right? Okay? So you're going to go against that, pressure against that. So press into my hand, okay? And you should be able to feel, relax. You'll feel this whole muscle, go ahead. And you'll feel this whole muscle contract. And it goes in underneath into the lesser tubercle. Relax. Feel it? Now we'll go. Okay. You feel it? Did you feel it all? How it contracts? So I want you to do that on everybody differently, okay? So that's all of the posterior axial appendicular. Turn over, we're going to do the anterior. Okay, so now we got the pectoralis major, and the pectoralis major helps with flexion of the shoulder, right? It helps with medial rotation, adduction, okay, and extension, right? So if he was to go up like this and you were to press against it, and you could feel right in here, right up in here, okay? You feel it. See? Feel it? So, like, what I would want you to do, and especially with women, everybody be careful, nobody get nasty, but I want you to go, if you can, go underneath here and grab it and feel it. Okay, because that's it. Okay, all right, that's it. All right, relax. All right, so now the next one is the pectoralis minor. Now, what I said was palpate for the coracoid process. So here's his acromion right here. Right here is his coracoid process. Feel it? Feel it?
That was Johnson, right? I knew it.
Underneath, right? Yeah, right. Is that tender in there? Yeah. That's it. If it's a tender spot, you got it. It's always very tender. Okay, did you feel it?
Ooh, yeah,
All right.
that's
So
right.
now what he needs to do is he needs to push down on the scapula, and you'll feel that pectoralis minor. Relax. Now press, contract. Okay, right in here. Feel it? And the book says you're supposed to go side laying too. Can you lay on your side facing them? Okay. And underneath here, all right, now try to press down on your scapula, bring your scapula, and you could feel it right in here, but it's hard to do it that way. Don't do that. Stupid. Lay on your back. What that book says. I want you to palpate it, however you can palpate it. I gave you the first, which is easier, so do it that way, okay? Now, the other one is the serratus anterior. And the serratus anterior is right around here. It goes from rib 1 to rib 8, okay? Right in here. And again, it protracts around. So, I'm trying to think which is, they say side lying too. You could do side lying. I think it'd probably be better. Turn to your side again. Okay, and just, actually, what else did they said if you do, lay on your back. Lay on your back, prone. Supine, excuse me, like this, and press into my hand. Press up, and you should feel it. Relax. Yeah, press up. Yeah, and you feel it, okay? So try feeling it like that. Press up. You feel it? Relax.
What are we
Press up.
feeling?
The serratus anterior. Okay, you got it? All right. And the last one is the subclavius, which is underneath the clavicle. Okay, it's from the clavicle to the first rib. This helps again in depressing the rib. I have not yet felt it, so don't worry about it.
Okay.
Okay, do all that, and then if you have studying, go ahead and go study.